Hi, it's Bethany from Smart Edition Academy. In today's video, we are going over a HESI A2 Practice Test. You can take this practice test along with me for free using the free HESI Practice Test link in the description below. In the links below, you will also find links to our HESI study group and the HESI online course. As we get started, I will read the questions and the answer options and then pause for a few seconds to give you time to think about the answer before I identify the correct answer and explain it. Let's get started. So for this test, we have 25 questions in 25 minutes. So our first question is, the knee is blank to the foot. Is it distal, inferior, proximal, or superior? So our correct answer here is proximal. So directional terms refer to the body in the anatomical position regardless of its actual position. The term anatomical position refers to a person who is standing upright with their feet facing forward and their arms hanging to the sides, and the palms of their hands are facing forward. Proximal and distal describes the position of a structure. Proximal is closer to the origin and distal means further away. In anatomy, the origin refers to the trunk of the body, so the torso, your chest, or abdomen. So the knee is proximal as it is closer to the trunk than the distal or further away foot. So our next question is, the maintenance of normal blood sugar is what type of feedback mechanism? Is it negative, neutral, positive, or proximal? So our correct answer here is negative. Most systems of the body are regulated by negative feedback mechanisms. These mechanisms maintain homeostasis. When you think of homeostasis, think of steady or consistent. Homeostasis is the maintenance of a relatively consistent environment within the body, such as thermoregulation or regulation of your body temperature, or maintaining your blood sugar or blood pressure. Negative feedback means that any deviation from the set point is made smaller or is resisted in attempts to maintain homeostasis. Which wave is associated with ventricle systole? Is it the P wave, the T wave, the ST segment, or the QRS complex? So our correct answer here is the QRS complex. So here's a picture of your cardiac cycle. So the cardiac cycle begins with atrial contraction and ends with ventricular contraction. When the heart contracts and pumps blood into systemic circulation, this is called systole. Diastole refers to the period of relaxation when the heart chambers fill with blood. This cycle can be seen on an EKG, which is what you're seeing here. The first wave on the EKG is the P wave. The P wave indicates atrial contraction or systole. Then you have your QRS complex. The QRS complex represents the combinations of the Q, R, and S waves. This indicates ventricular systole or ventricular contraction. And then your T wave represents ventricular diastole. The flat line between the S and the T wave is the ST segment. What is the purpose of an electrocardiogram? Is it to indicate the rate of blood flow, to display the heart's rate and rhythm, to identify a person's blood group type, or to determine the cell type in a blood sample? So the correct answer here is to display the heart's rate and rhythm. So I'm going to go back to this picture of the EKG, which we were looking at for the last question. So The heart is a muscle and it transmits electrical impulses that cause the heart to contract. This electrical activity can be recorded using an electrocardiogram, which you may hear referred to as an EKG or an ECG. An EKG is commonly performed to assess cardiac rhythm and is used to detect heart disease. So you'll either see a simple EKG readout like we see here, or you will see a more complex EKG readout such as from a 12-lead EKG. Which statement is true regarding gas concentration of blood leaving the left side of the heart? Is it oxygen levels are high, carbon dioxide levels are high, oxygen and carbon dioxide levels are low, or oxygen and carbon dioxide levels are high? The correct answer here is that your oxygen levels are high. So if we look at a diagram of the heart and of blood flow through the heart, blood flow in the left side of the heart is oxygenated. So deoxygenated blood enters the right atrium right here and travels to the right ventricle by passing through the tricuspid valve. The right ventricle contracts and pushes blood through the pulmonary valve into the pulmonary artery, where the blood then travels to the lungs and becomes oxygenated. Oxygenated blood enters the left atrium right here by way of the pulmonary vein. So remember, this is the only time that oxygenated blood is going to be transported by a vein. So oxygenated blood enters the left atrium, travels through the left ventricle by passing through the mitral valve. The left ventricle contracts and pushes blood through the aortic valve into the aorta, where it travels through the body. So blood leaving the left side of the heart is always going to be oxygenated, and it's going to travel to the body and deliver that oxygenated blood. So your oxygen levels are going to be high in that blood because it's just come from the lungs. So oxygen-rich blood is blood that has a very low pH level, flows into systemic circulation, leaves from the right side of the heart, or contains a high concentration of carbon dioxide. So the correct answer is flows into systemic circulation. If we go and look back at that diagram that we looked at for the last question, your oxygenated blood is here in this left side of the heart. The left ventricle squeezes that oxygenated blood through the aortic valve and into the aorta, where the blood travels systemically to the rest of the body. Irritable bowel syndrome, or IBS, can be a painful disorder of the digestive system. Which of the following is a symptom of IBS? Is it bloody stools, an inflamed colon, abdominal pain, or a swollen abdomen? So your answer here is abdominal pain. IBS, or irritable bowel syndrome, is a disorder of unknown cause in which intestinal mobility is abnormal. Patients will exhibit pain, generally in the left lower quadrant, especially after eating, and they may have alternating bouts of diarrhea and constipation. The lining of the stomach is covered with rugae. What is the benefit of this? Is it to increase the output of gastric juices, increase the surface area of the stomach, increase the permeability of the stomach walls, or increase the type of nutrients that can diffuse? So the correct answer is rugae increases the surface area of the stomach. So if we look at a picture of the stomach, The rugae is the folds of the stomach lining, and these folds will stretch out or provide elasticity, allowing the stomach to expand, thus increasing the surface area or the volume of the stomach. Sperm is combined with other components to form semen. These other components are formed mainly in which of the following? The penis, the glans penis, the male accessory glands, or the female accessory glands. So the correct answer here is your male accessory glands. So sperm is produced in the testes, which are inside of the scrotum. Sperm passes into a series of coiled tubules called the epididymis, which is right here. The epididymis stores and provides nutrients to the sperm until they are ready to be passed into the vas deferens. So the vas deferens is a tubule right here. It runs all the way up this way. That is about 30 centimeters long. It extends from the testicles into the pelvis and ends at the ejaculatory duct. The epididymis and the vas deferens are supported by several accessory glands that produce the fluid components of semen and support the sperm cells. The vulva is comprised of all of the following except the cervix, clitoris, labia majora, or the vaginal opening. So the correct answer here is the cervix. So if we look at this diagram here, the vulva is only composed of external components, which is not seen here, but includes the labia, majora and minora, the clitoris, and the vaginal opening. And then your cervix, which is right here, is the opening of the uterus, and it is what connects the uterus to the vagina. Why is glomerular filtrate important? Is it because it causes solutes to diffuse back into the renal artery? It uses the forces of blood pressure to reabsorb urea. It secretes nitrogenous waste into the urine for excretion, or it increases the concentration of urine in the collecting duct. So the correct answer here is that it increases the concentration of urine in the collecting duct. So during glomerular filtration, blood enters the kidneys through the renal artery. This artery branches off into capillaries, allowing blood to flow into the glomerulus of the nephron. Blood pressure forces water and solutes, which are smaller than proteins, to diffuse from blood across the capillary walls and through the pores of the Bowman's capsule into the tubule. Roughly how many liters of blood flow through the kidneys each day? Is it 75, 100, 180, or 425? The correct answer here is 180. So roughly 180 liters of blood pass through the nephrons of the kidney each day. Much of this fluid and its contents must be reabsorbed, and then the byproduct of this fluid, which is urine, is emptied into the bladder for storage, where it's later excreted. Bones are primarily made of chloride, magnesium, sodium, or phosphorus. The correct answer is phosphorus. So although bone is a hard structure, it can grow. This is especially important in childhood. Ossification is the process of bone formation that occurs during the embryonic development. This process transforms soft and flexible cartilage to hard bone. It does so by replacing the cartilage with mineral deposits, specifically calcium and phosphorus. Ossification begins in the center of the bones and spreads towards the end of the bones. Which organ does the vertebral column protect? Is it the brain, the heart, the spinal cord, or the pelvic girdle? So the correct answer here is the spinal cord. If we look at this diagram of the skeletal system, anatomically, the skeletal system is divided into two major divisions. You have your axial skeleton and your appendicular skeleton. So your axial skeleton consists of bones of the skull, the sternum, the vertebral column, and the rib cage. The spine is protected inside the vertebral column, and it runs through the center of the vertebral bodies, which are your individual bones here in your vertebral column. The appendicular skeleton is comprised of bones of your upper and your lower extremities, including your pelvis. What does actin attach to? Is it the Z line, the I band, the M line, or the A band? The correct answer is the Z line. So if we take a look at this picture, actin is a protein molecule that links together to form thin bands of myofilaments. So you can see the actin filament is represented here by these blue lines. Myofilaments make up a myofibril, which is a long cylindrical protein that fills a muscle fiber. Actin is attached to your Z line or your Z disc. So here's the Z line. You can see it's got that name because it looks like a Z. A study shows that decreased calcium content possibly contributes to poor skeletal muscle contractility. Which of the following structures was most likely observed to arrive at this conclusion? Is it the H zone, the actin myofilament, the cardiac muscle fiber, or the sarcoplasmic reticulum? The correct answer here is the sarcoplasmic reticulum. The sarcoplasmic reticulum surrounds the myofibrils and the skeletal muscle fiber and houses a certain concentration of the calcium ion. Decreased levels of calcium in this structure can affect the muscle contraction, which can lead to poor skeletal muscle contractility. What substance is required to drive the slide filament process? Is it ATP, hormone, potassium, or water? The correct answer here is ATP. So the slide filament theory explains muscle contraction. According to this theory, actin filaments slide past myosin filaments, pulling the actin filaments closer to the center of the sarcomere or the M line. This sliding action happens because of the interactions between the heads of actin and the myosin. With the help of energy in the form of ATP, the myosin heads are energized to attach to binding sites in the actin, and they form a cross bridge. A dermatologist explains to a patient that a bacterial infection has affected the sebaceous glands. Which layer does this form of acne directly affect? Is it the stratum basilar, the stratum lucidum, the stratum corneum, or the stratum granulosum? The correct answer here is the stratum corneum. So if we take a look at the layers of the skin, the stratum corneum is the top layer, or the outermost layer of the skin. And when acne forms due to a bacterial infection of the sebaceous glands, acne or pimples will form on this layer of your skin. During basal cell carcinoma, the epidermal cells in the stratum basial do which of the following? Do they invade the dermis, form a waterproof layer, undergo mitosis normally, or fill with a large amount of keratin? The correct answer here is that they invade the dermis. Basal cell carcinoma is the most common type of skin cancer that occurs in the basal cells of the epidermis. So these cells are found in the stratum basial layer, and they divide to create keratinocytes. Basal cell carcinoma rarely spreads or undergoes metastasis. If a person smells something sweet, what form of information is this initially perceived as in the nervous system? Is it cognitive, integrative, motor, or sensory? So the correct answer here is sensory. So the sensory nerve is the nerve that carries sensory signals from the external environment to the brain. So your sensory information is smells, as well as sight, sound, taste, and touch. Which of the following most likely directly stimulates the excitation of a neuron? Is it an astrocyte, a muscle fiber, the myelin sheath, or a neurotransmitter? So the correct answer is a neurotransmitter. So your neurotransmitter is a type of substance that is released from the presynaptic membrane of a neuron and binds to the receptor on the postsynaptic membrane of a different neuron. By creating this binding, the substance stimulates excitation of the neuron, causing a neutral impulse to be transmitted. What disease results when the pancreas cannot uptake the glucose in the bloodstream properly? Is it Addison's disease, arthritis, diabetes, or hyperthyroidism? The correct answer is diabetes. So with type 1 diabetes, the pancreas is not making insulin, or it's making very little insulin. Remember, insulin is the hormone that helps blood sugar enter the cells in the body where it is used for energy. Without insulin, blood sugar cannot get into the cells, and instead it builds up in the bloodstream. So with type 1 diabetes, the issue is that the pancreas is not making insulin or makes very little insulin, and your blood glucose levels build up. Then you have type 2 diabetes. So with type 2 diabetes, your cells are not responding normally to insulin. This is also known as insulin resistance. So your pancreas makes more insulin to try and get the cells to respond, but eventually the pancreas is unable to keep up, causing the blood sugar to rise. So with type 2 diabetes, the pancreas is making the insulin, but eventually the pancreas cannot make enough insulin to keep the blood sugar levels from rising or from building up. In stressful situations, acetylcholine is produced. Which intracellular chemical signal is responsible for this action? Is it autocrine, neuromodulator, paracrine, or pheromone? The correct answer is neuromodulator. So neuromodulators are chemical signals that are secreted by nerve cells and aid the nervous system. B cells label invaders for later destruction by which of the following? Antibodies, macrophages, proteins, or T cells? So the correct answer is macrophages. So when a foreign body or a pathogen, such as a virus, for example, enters the body starts to fight. During this fight, the B cells and the T cells work together. Helper T cells activate the T cells and the B cells. The killer T cells attack and kill the infected cells, while the B cells mark or label the pathogen for later destruction by the macrophages. Antibodies attach to invading pathogens, marking them for which of the following? Destruction, penetration, reproduction, or transformation? The correct answer is destruction. So remember, an antibody is a type of protein that is produced by the body's immune system when it detects a harmful substance or an antigen. So each antibody is designed for only one specific antigen, and there are many different antibodies found in the body. Each one is unique and protects the body against specific antigens that it can detect at any given time. The main reason for the binding of the antibody to a specific antigen is to help destroy it. So while some antibodies can destroy the antigens directly, others make it easier for your white blood cells to come along and destroy the antigen. So your antibodies are marking those pathogens for destruction, either by the antibody itself or by the white blood cells. So thank you for taking the time to take this practice test with me. If you have other sections of the HESI you need to take a practice test for, please use the link below to access the full-length free HESI practice test covering all the sections. Good luck with your studying.